Today we will be reviewing ketamine administration IVIO for pain management per our EMS protocols. You'll see this will be for adult usage only. Our dose is going to be 25 milligrams, and we're going to be using the ketamine 100 milligrams per 1 ml to achieve this desired effect. So as you look at our vial here, there's 5 milliliters, contains 500 milligrams, and it's 100 milligrams per 1 ml. So what that means is we're always going to use a 1 cc syringe with the lure lock, and we're only going to pull up 0.25 mLs of ketamine into the syringe. So I'm going to go ahead and show you that procedure real quick. There's a couple different ways of doing it. You could use the needle to pull it out of the vial, or you could use the mini spike and make this a needleless operation. So I'm going to go ahead and demonstrate it with the actual mini spike. And again, I said that we're going to pull up 0.25 mLs, which equals 25 milligrams. Then you have 25 milligrams, and now we need to dilute that. So there's a couple different ways. We're always going to dilute this, though, with the remainder of the syringe, the 1 cc syringe, with normal saline. We're going to obviously have an IV or an IO line that is running, a patent line. And as it's running, we're going to go ahead and pinch it off to the patient. That way we could actually pull right from the port itself. That's why it's so important to have the 1 cc lure lock syringe, because it'll actually clamp on to the end of your IV tubing here itself. So we're going to go ahead and pull back now. As you can see, we're pulling straight saline into here. And then we would actually have 1 ml, 0.25 mLs of ketamine, which is 25 milligrams, and 0.75 mLs of normal saline. And that would be our dose, 25 milligrams for pain management. Now we would go ahead and deliver this to our patient over 1 minute's time. Okay, now we're going to be talking about the EMS protocols, ketamine administration for multiple different things. We're going to use it for the violent impaired patient that has a patent IV line. We're going to use it for CPR-induced consciousness. And what I mean by that is you have your Lucas machine on your patient, and the patient continuously wakes up. As soon as you shut off the machine, the patient goes back into cardiac arrest. So obviously you know the patient's going to need the Lucas machine to be running, so we want to sedate that patient. And it's going to be the same dose as the violent impaired protocol, which is 200 milligrams. And then we're also going to talk about advanced airway procedures. You have the option now to use etomidate or ketamine as an induction agent, as well as post-intubation sedation. The dose is all the same. They're all 200 milligrams. And we're with the same concentration, which is 500 milligrams in a 5 milliliter vial. The concentration is 1 ml equals 100 milligrams. So the good thing is the dose is all the same for all three of those things that I spoke about earlier. It's 200 milligrams. So we know that each milligram or each ml contains 100 milligrams. So we only need 2 mLs for this particular procedure. So again, you could go with the needle to draw it up, or you could go with the needleless operation. This time we're going to use a 10 cc syringe. So now we're going to go ahead and draw our 2 milliliters of ketamine into our 10 cc syringe. And again, that's going to give us a concentration of 200 milligrams. So now we have 200 milligrams in a 10 cc syringe. So now we have 2 mLs of ketamine with 8 milliliters of dead space. So what we have to do now is, just like every other ketamine administration, we have to dilute the dead space with normal saline. So we'll make sure we have our running patent IV or IO line. We're going to go ahead and clamp it off from our particular patient who's getting the ketamine. And we're going to go ahead and draw in the normal saline to our 8 mLs of dead space in our syringe. And you'll see it's going to easily fill up the chamber of the syringe with the normal saline. Okay, I'm going to go ahead and pinch that off, make sure we have all the air cleared out of the syringe. Now we have 10 mLs total in the syringe, and it's actually going to be 200 milligrams of ketamine in here. So we're going to go ahead and pinch off to the IV bag. We're going to hook it up to our J-loop or our IV tubing, and this is going to be a slow IV push. We should be delivering this roughly over 1 to 2 minutes, and if we push too rapid, it's actually going to cause the patient to have a laryngeospasm. So we want to avoid that high dose concentration without normal saline and rapidly pushed. Now we're going to talk about ketamine administration, IVIO, for pediatrics. There's only one particular protocol that you're going to find ketamine administration for pediatrics, and it's in the advanced airway protocol. So you'll see it's over 36 months is when we're allowed to utilize the ketamine. So just like the advanced airway for the adult patients, we're able to give this as an induction agent or etomidate. Then in the post-sedation intubation portion of the protocol, we also have the opportunity to continuously sedate them with ketamine. The dose is simple. It's 1 milligram per kilogram. So now we're going to demonstrate drawing up ketamine, same concentration as before, 100 milligrams in 1 ml, for advanced airway procedures in our pediatric patient. So for this demonstration, we're actually going to use a 7-year-old. We're going to utilize our hand-heavy drug guide. We're going to look up under the 7-year-old page and find ketamine where it says RSI sedation. It's going to tell us our dose should be 25 milligrams, 0.25 mLs. So just like pain management, we're always going to use the 1 cc syringe. You have the 2 options to insert into the vial to actually get the medication into the 1 cc syringe. I'm going to choose the mini spike. I prefer to go needleless whenever possible. And then we're going to draw up 0.25 mLs, which is going to equal our 25 milligrams. Make sure we get the air out of there. We're going to go ahead once again and pinch it off to the patient. We're going to draw up the remainder dead space of the actual 1 cc syringe with normal saline. So again, we'll have 1 ml that contains 25 milligrams of ketamine. As soon as this process is complete, we'll pinch off to our running line for administration. And once again, this is going to be a slow IV push, roughly over 1 to 2 minutes.